I'm Meg Evans, the Managing Editor of Spectroscopy, and I'm here today with Dr. Paul D.A. Pudney of Unilever Discover Colworth Laboratory. Dr. Pudney, thank you for joining us today.
It's my pleasure. More than happy to talk to you.
Why did you think it was important to develop a Raman probe that was capable of scanning a wider range of body parts?
Well, in vivo Raman of skin has made great strides in recent times, and it's said to be in the forefront of skin research. It gives a unique insight into the skin, and often the skin has been called the window on the body. So skin health is very important for many parts of the body. It is thought that different parts of the skin on different body sites are different. Well, that's certainly true of your hands and feet skin. They're definitely different from the rest. But evidence from elsewhere on the body is not so conclusive. However, many of these areas, such as your scalp and underarm, we treat with different products. So trying to understand how these are different may give us a better understanding of these areas that then allow us to develop products with improved benefits for these areas of the skin specifically aimed at them.
What challenges did you have to overcome to make the instrument work on curved areas of the body? Did you have to sacrifice sensitivity or accuracy in any way?
Well, the challenge was to produce something small enough that could fit into these areas of the body while the subjects, people, are comfortable and in their natural state, and also to be still while the measurements take place. So, for instance, if you're looking at the underarm, you don't want them to be sweating uncontrollably while you're measuring them. Of course, the instrument still needs to perform really well, and this is where working with my co-authors at Rivet Diagnostics under Professor Gerwin Pupples was essential. We discussed a number of approaches that we could do to do this, like using fibre optics. However, Gerwin's previous work had shown that you get a small background from fibre optics, especially when you move them. Although this is small, this can reduce the quality of the data enough to cause a problem. You have to also remember that what you're trying to study. So we went for a solid format. So in this case, it's pen-shaped, it's thin, and can quite easily go into like the underarm or the scalp. This gives us a very good signal to noise, as we show in the paper, and it allows you to do all the analysis that you can do on the data that you get from the foliar forearm with what I suppose we could call the standard in vivo spectrometer, although it's far from standard. It's a very highly refined instrument in itself.
How do you expect this development to affect future diagnosis and the medical field in general?
Well, it's known that the skin barrier is a vital component of health of the skin generally, and say in one of our areas of study, scalp health. So, for instance, on the scalp, Malassezia fungi play an important role in dandruff. But everyone has Malassezia, but not everyone has dandruff. So we believe looking at a weakened scalp barrier may play a role in the susceptibility of dandruff. This is where the Raman measurements provide a much more detailed picture of the biochemistry of the stratum corneum than is previously available, and how that differs from, say, for instance, from a dandruff scalp. This knowledge can help us look for improved treatments to directly target the stratum corneum. Similar approaches are being used to study skin conditions like atopic eczema. However, it should be borne in mind that the original spectrometer was developed to help with skin cancer diagnosis, which it certainly can do.
In your paper, you explain that the findings for the scalp and the axilla skin were significantly different from normal volar forearm skin. Did you expect to get those results?
Well, there have been a few reported observations that indicated that they may be different. It's known that the stratum corneum thickness is different in these areas. However, there was nothing definitive from any technique that showed that they were different. So, although I would say I did expect some differences, I could not predict what they would be. For instance, that we did not know that the scalp would have significantly lower levels of NMFs, natural moisturizing factors. This was not known beforehand.
How will this research impact the food and beverage industry?
Well, we've been looking at the way T polyphenols, for instance, interact with the mouth. T polyphenols such as EGCG are known to have various health benefits, but also have a very astringent taste, that puckering feeling you get from tea or also from red wine. The mechanism of astringency is still much debated, so helping to be able to study this in vivo could be a great help. And this may allow us to be able to understand the way the mouthfeel is, and then having nicer products to be able to give a better mouthfeel, which may have also can be fortified, say, with these T polyphenols with health benefits.
What are your next steps in this research?
Well, there are a number of studies that we'd like to do in using the probe as is, like, as I've mentioned, getting a deeper mechanistic understanding and causes of dandruff, for instance. However, of course, as a measurement scientist, we're always thinking of ways to improve the instrument itself. It would be very nice to increase its speed, that we can take the measurements, and also still its flexibility. The way that we can place the instrument on the body, it still takes a bit of doing, so that could be improved.
Dr. Pudney, thank you so much for talking to us today.
Thank you very much for speaking to me.